said that you know that, but I wouldn't be standing up here doing my job if I didn't remind everyone. Make sure you're doing your good respiratory hygiene. You're washing your hands a lot. You're using hand sanitizer if you don't have access to a sink. You're taking those precautions to stay home if you're ill, and if needed, contact your healthcare provider, call your healthcare provider and seek advice. And make sure that if you're in those high-risk populations, you have extenuating health circumstances, you're elderly, please be staying home from the public and staying away from the public as much as possible. Again, like I said, now is the time for us to really continue to step up our actions as a community. And one of the things that we are going to do additionally as the City of Sioux Falls is we are also building out our Emergency Operations Center. We've had a planning group that's been meeting for some time here, and now we're going to actually, as of tomorrow morning, open up our Emergency Operations Center, and it'll be a multi-agency team with our health systems to make sure that we can continue to work together to manage through this time period and make sure that we're making really good decisions for the community. So, you know, I don't know if lucky is the right word to use, but we're somewhat fortunate because we've seen what's been happening in other states in the country, and we've been actually, seeing what's happened across the globe. And so we have there's lessons learned, there's best practices already starting to emerge. Just recently we got some new guidance around mitigation strategies for communities, which has helped inform us today in making the decisions that we are. And so we are going to be able to make a difference. That's what we do in Sioux Falls. That's who we are. We can do this, and I have no doubt we can make a positive impact for our community. Thank you.
I just want one last point of clarification before we open up to questions. A limit on events and saying we're trying to put a cap on events of 250 people, those are at city-owned facilities. I can't dictate if a church wants to have church or if other private gatherings want to occur. What we can say is that's the role we're taking, and we'd encourage our community partners to follow suit because we think it's a best practice. It's a CDC recommended best practice. I would encourage those who have events coming up like that aren't in city-owned facilities just to think twice about them, as we have. There's some tough decisions we've had to make because of this. There's some disappointed people because of this, but it's the right move based on what Jill just mentioned in terms of a very proactive plan of response. So we have our partners, Dr. Wilde and Dr. Erickson from Sanford and Avera with us as well, so we'll open up for questions that you have for any of us.
What do you need to see in the next 14 days to lift these restrictions?
I think one of the things we need to see is a slowing of the cases that we've seen in the state. So if we feel that we're starting to level off for some reason, we can maybe take a look at it. But we're going to be very cautious on lifting those restrictions. Any more than that, Joe, we also have a lot of events large events that are booked out further in advance, and they're really watching us. So we don't want to be overly in panic mode and hamper some of the events that we have scheduled in our community into the future. So we're starting with 14 days, and we'll assess from there. But we're going to rely heavily on our partners from the healthcare organizations and the State Department of Health to tell us what the trending is and what they feel the community risk is.
When you made this decision, did you know that they were going to, Noam just had her press conference, said there were no new cases in the last 24 hours. Did you guys make this decision before that news was known?
We did, yeah, we did.
Where's your emergency operations center going to be located? Can you tell us about that? What's going to take place there?
So I'll invite Jill up here as well to talk about this if you want, but our Emergency Operations Center typically is at our Law Enforcement Center. That's where it will be again for this. That's an ideal location because it allows us to catch the media at our public safety briefings as well for updates. How that typically looks is there's city, county, state agencies in there. We're going to have our healthcare partners that will have staff there as well so that we're all communicating. We have a public information group. And one of our goals as a city is just to ensure that we, one, keep the community safe. That's goal number one. But second, that we continue to provide the services we need to provide to our residents while dealing with what is now labeled a pandemic in the U.S. And so, Jill, I don't know if you have anything else you want to touch on the EOC? Okay, so that's how we'll stand that up.